Auscultating lung sounds. We'll go over normal first. The most common term you'll hear is vesicular, which describes normal air-filled lungs and is heard over most lung fields. Tracheal, think trachea is like a tube, so it sounds hollow. Bronchial is over the sternum, and bronchovesicular is heard where the bronchi sit in the lungs. Now, abnormal, these take time to recognize, so don't be hard on yourself. Wheezing, keyword here is musical. It's a continuous sound because it's heard for a longer duration during breathing. Think wheeze, whistle like a musical. Let's listen. Bronchi, think of a rhino, and they make some low-pitched, deep sounds. This one's continuous too, but may clear with coughing. Let's listen. Stridor is our last continuous one, and it's similar to wheezing, but it usually occurs with severe narrowing of the airway like an obstruction. Let's listen. Crackles, there's two types. Fine sounds like when you move your fingers through your hair, and coarse like wet bubbling. Big difference is that fine clears with coughing and coarse does not. Let's listen. And last, pleural friction rub. Keyword here is leathery sounding, and this will be heard with every breath in and out. Let's listen.